Hello everyone, welcome back to my YouTube channel. My name is Alona Forte. I am a retired community health nurse, adaptation consultant. I am also an author and an educator. So some of you may be able to watch my previous video about COVID, pregnancy and breastfeeding, and the previous video that I did as well was latching. So today, as I promised, I'm going to talk about positioning in breastfeeding. Why? So many moms in my previous experience in our breastfeeding clinic struggle with positioning while breastfeeding. Why? Because they have tears down there, laceration or episiotomy, they have C-section, or the baby have vacuum delivery and there's a big hematoma, or the baby's head is traumatized. So they find it so uncomfortable to latch knowing that there is head trauma down there. So today I am going to talk about, I'm just going to get my little reminder here. Okay, I'm going to talk about different positions in breastfeeding. Now, first of all, as I mentioned when I did the latching video, when you choose a position breastfeeding, you need to consider different factors that you need to do prior to positioning. Number one, you need to get a good chair. A chair like this, without arm, is comfortable when you have a bigger baby, that you can just rest your elbow into the arm. However, if you have a tiny little baby that you struggle with holding, this is more comfortable for you to move around because there's no arm that distracts your movement. So if I'm going to start with C-section. When you have C-section, sitting in a chair is going to be so uncomfortable, especially after 3 days, 4 days, because you'll still be sore or your back is still sore. So the best position to breastfeed while you have C-section, either you have a really comfortable couch, not a lazy boy, because a lazy boy you cannot bend your tummy. So a really comfortable chair. This chair is good. You can put a pillow at the back of your chair, like this pillow. You can put the pillow at the back of the chair, or you can also, some moms would be comfortable. If you are comfortable standing, you can do standing and breastfeed your baby. Now the first comfortable position I'm going to teach you is what is a football position. Because you have C-section here, this is uncomfortable. I want you to do a football position. So a football position is good when you don't have no arms in your chair, it's open. So if you have a baby, so when you do football, I'll just push this table. Football position, see that? Again, as I mentioned when I did the latching video, the nose should be at the level of my nipple. So baby's nose is right at my nipple. So when you do this, you are supporting the baby's neck. See that? That's my hold. Look at my hands. My hand is not here. Bad when you do that, because you are pushing that head towards me and you're putting pressure. I want you to put your hand right below the neck. See how I'm supporting the neck? So when you do that, that's a good hold. So you're protecting the baby's head. At the same time, the baby's back. You are using your elbow to tuck in that bum. Because if the baby is moving around, or if the baby is very small. So this is her. So you position the baby's mouth close right into your nipple area. So this is good when you have C-section, okay? Now, if you have a preterm baby, a small baby, this baby is sometimes showing low tone, meaning a hypotone baby. So what you can do, best position to do that, is use a cross cradle position. Why? When you do a cross cradle position, you do have a good grip, a good feeling that you can hold your baby fully, comfortably, and the baby is comfortable. Again, when I mentioned the latch, the baby's nose should be at the level of my nipple, okay? So again, I'm using my elbow to tuck in the baby's bum, supporting the baby's neck. Never do this, okay? Because when you do this, the baby will come off, scream, fight with you because, mommy, what are you doing? I cannot breathe because you're pushing my head down. You're putting pressure. So don't do that. That is a no, 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 no. So just hold the baby like this. Now, if the baby is older, comfortable, you can do the cradle hold. This is a cradle hold. I do this when baby is already older, maybe a week or two, and when breastfeeding is already established. Why? Because at this point in time, when baby's older, bigger, the baby is already able to kind of support the head. Because see, when you do this, you're supporting the head. This is cross cradle. When you do cradle, sometimes the baby's head is moving around like that. So it is important to put consideration on how big your baby is. If your baby is hyper moving around, use cross cradle. Because when your baby is hyper moving around, you can control that movement. But when you do cradle hold, your baby is free. So sometimes mom would start with a cross cradle, establishing feeding maybe around 5-10 minutes, and then do the cradle hold. So you're free. You can eat snacks while you're feeding, breastfeeding. You can drink water while you're breastfeeding. You know why? Because if you're hungry and you're breastfeeding, if you're thirsty and you're breastfeeding, there is not so much pleasure in your brain that will trigger that milk letdown. So make sure before you even start breastfeeding, make sure you eat, make sure you drink, make sure you have snacks, so you can chat around, you can watch TV. It relaxes your brain. When your brain is relaxed, you know what it does? It triggers the release of oxytocin. And you know what's that oxytocin in? It's a pleasure feeling. Just like sex, is a pleasure feeling that will trigger milk letdown, meaning the spray of your milk when you're breastfeeding. I'm going to talk more about milk later on, but we'll focus on positioning. Again, if you have C-section, you can do football, or you can do cross cradle. It depends on how you feel. Now, if you have a big breast, what if you have a breast like this? If you have a big breast like this, and you have a tiny baby, so you're going to struggle with latching because your baby's face is smaller than your breast. And there's so many women out there who have bigger breasts, okay? Small women with big breasts, big women with small breasts. So either way, there's a way on how you can do it perfectly. So if you have a big breast like this, and you want to latch a baby, what you can do is, if you have a counter table in your kitchen, or kitchen table, put your baby in the kitchen table, blanket, kitchen table, baby's in the kitchen table right now. I want to put my breast right into the kitchen table. I don't have a table, but the breast is laying flat into the kitchen table or counter. So you can breastfeed. It sounds funny, it looks funny, but it's very comfortable because mom doesn't have to support the breast. Or another technique for a large-chested women. See this? You can roll a fabric, any face towel, roll it up to support your breast so that the baby's face or tummy won't be squeezed with the weight of your breast. So if I put my baby here right now and I have this towel underneath, that support the weight of the breast instead of the baby's chest is holding to the weight of my breast. Understand? So let me tell you this. Breastfeeding for me is not easy. If you don't know the tricks, if you don't know about the skills, the knowledge of how you can do it perfectly, there is no such thing as perfect breastfeeding. when you don't know about the skills and the tricks that I told you. So to get into a perfect breastfeeding and perfect latch and perfect position, you need to understand that there are so many factors that you need to know and be aware of so that you can fix the problem while you're breastfeeding. So that's it for today for positioning in breastfeeding. Later on, again, I'm gonna be doing more videos about how to calm a baby, how to know if my baby is full, stuff like that. So follow me in YouTube. Please subscribe and click the notification button. And again, thank you for watching. My name is Alona Forte. Thank you.